Joining us now, Republican Senator Bill Cassidy of Louisiana. Thanks very much for being on the show this morning.
Good morning.
Before we get to health care, what do you think the Republican takeaways are from the big win last night in Georgia?
I think Steve's points were right on. I also think that the United States continues to be a center-right. They don't want the federal government telling them what to do. Somebody mentioned outsiders. The federal government is the ultimate outsider, and the American people are kind of sick of that. And so when Bernie Sanders endorses the fellow, that's kind of the epitome of we're going to tell you how to live your lives. Again, don't want that.
All right, let's move on to health care. Have you seen the bill?
No, we've discussed it in great detail, but have I seen writing on a piece of paper? I have not.
Okay. Can you tell us what it might look like if you were to see it?
Yeah, there's a lot of effort to stabilize the individual market. Obviously, before President Trump took office, about 11 states were in a so-called death spiral in the individual market. Since others have joined, you can argue why, and at this point, the person paying $40,000 for insurance doesn't care. They just want it fixed. So there's a lot of effort to that, and there's a lot of consideration of what we do with Medicaid as well.
I guess it's hard to ask if you're satisfied with it when you haven't seen it.
So,
do you think you'll get a chance to see it and really read the whole thing to be able to really say whether or not this is satisfactory?
If I don't get to read it, I don't vote for it. If I don't get to study it, I don't vote for it.
Okay.
And so it's just a question, we've had pretty detailed discussion, though, as to what we wish to do. I'm not defending the process. I don't like the process. Mm-hmm. But that said, I can either sit around and complain about the process, or I can dig in and try and make it better.
Senator, it's Willie Geist. Good to see you this morning. There are a lot of Republicans, even not just Democrats, who are worried about the rollback of Medicaid expansion. Can you speak to that? What might be inside the bill for people who are currently enjoying the benefits and are worried they won't be covered if this becomes law?
Yeah, there's a couple ways this can go. Let me give the better way. One thing that is not fully appreciated is that the current Medicaid expansion is not sustainable for states. States will be picking up 10% of that expense in 2020. For California, that'll be $2.2 billion a year. My state, $310 million, much smaller state. You can go around the nation. The states that expanded cannot afford their 10%. So there's something that has to be done to make it sustainable both for the state taxpayer and the federal. We got to take care of the patient. I'm a doc. We've got to take care of the patient, and that's kind of the sweet spot we're trying to search for.
So how do you take care of the patient? What do you say to somebody like Governor John Kasich in the state of Ohio who says, wait a minute, guys, you cannot do this to hundreds of thousands of people in my state?
Well, Kasich has recommended, I think in private, maybe not in public, but I don't think you'd mind me saying, rolling back that 138 federal poverty level kind of upper limit of eligibility to 100%. But what you have to do if you do that is for the credits that go for folks getting their insurance through the exchange, it has to be more generous, so there's not a big cliff coming off of 100%. If we can do that, and again, we don't know the size of those credits yet, I don't at least, then you can actually transition people and make the program sustainable for the state taxpayer and the federal taxpayer.
So are you comfortable as a senator and as a physician that all those people who benefit from Medicaid right now, whose health is taken care of by Medicaid, that they'll be okay? There won't be some big gap in the middle as they transition if this becomes law?
Put it this way, I can't tell you that. I've not seen writing on a piece of paper, but that's what I'm hoping for. Let me mention one thing. Something in the Patient Freedom Act, something Susan Collins and 4 other Republican senators put up, allows something called automatic enrollment. Somebody who is eligible for a program is enrolled unless they choose not to be. I asked Tom Price yesterday, could they put through a waiver process, the state applied, the federal government approved, for automatic enrollment into Medicaid? He says yes. He thinks he has that authority. Now think about that. The mentally ill patient living beneath the park bench who currently is never enrolled, but if he is enrolled, perhaps could get the medication to put him back into society, could be enrolled through a process such as this, making him automatically eligible for the medications he needs for wholeness. In that case, this would be an improvement over status quo.
Senator Steve Kornacki, in the run-up to that special election in Georgia yesterday, there was a lot of talk that if the Democrat won that race, that you might have some wavering Republicans looking at this health care bill, whether it was in the Senate or if it went back to the House, who looked at it and said, boy, maybe we better think twice before moving forward on this. Now that the Republican has actually won that race by 4 points last night, what effect do you think that's going to have on your colleagues as they consider the politics of this bill?
I think a bigger effect than that is the fact that President Trump has, both in a lunch with senators and tweets and interviews, said that he thinks the Senate bill should be more generous. During the campaign, he said he wanted all covered, caring for pre-existing conditions, eliminating mandates, but lowering premiums. If we can achieve President Trump's goals, that is contract with the voter, we will have achieved a lot. I think the president's trying to support that effort right now.
Senator Cassidy, before we let you go, I want to ask you about your friend and colleague, Congressman Steve Scalise, and if you can share anything about how he's doing today.
Yeah, I've just heard kind of through the grapevines, staff who know each other. He's tweeting, he's talking, his brain is working. You got a sense that he was in shock, as a medical term, in shock with low blood pressure when he went to the hospital. His brain is working wonderfully. He's talking to his family. The doctors are just kind of flabbergasted how quickly he's improved. Prayers are working, thoughts going out are appreciated. We're all for Scalise.
Well, that is great news. Please give him our best, too, Senator. Thank you.
Senator Bill Cassidy, thank you so much, and thank you for that update.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.